Hello, thank you so much for staying on the AM show. To our next big story today, we are speaking to the Ghana Nurse Midwife Trainees Association, and they are here because they haven't been paid their allowances, and this was generated such a huge conversation in the build-up to the elections because, as you were aware or are aware, the allowances were scrapped by the previous NDC administration, and the campaign promise of President Akufo-Addo, then candidate Akufo-Addo, was to reintroduce these allowances. Now, the nurses or the trainee nurses haven't been paid for more than 14 months, and they have some concerns to raise. And this morning, I've been joined by Lenof Amponsa. He is the National Secretary for International Relations, of the Ghana Nurses Midwife Trainee Association, and Isaac Nana Kofi Arthur is National Coordinating Secretary of the same association. Great to have you here this morning. All right, so for 14 months you've not been paid. Government says it doesn't have money for a lot of things. Okay, so I mean, right here on this show we have conversations. Contractors have not been paid. Even some CTAG, for example, which is still on strike, has not been paid. And the response we get all the time is, we understand that the current situation we're in, government doesn't have money. Can't you give government some more time while it figures everything out? You know, let me start with you, Lenof.
All right. I think we've given government enough time. The training nurses, it's been almost 1 year now that government haven't paid our allowance, and we've given them enough time. At this time, we are suffering. The trainee nurses are suffering. We are saying that there's no money, but the teacher trainees are being paid. That is our worry. This was a promise that was given to both trainee nurses and teacher trainees. So why is it that at this point in time, government is saying they don't have money? They are saying we are going to IMF. We are now at IMF. Russia-Ukraine war. These are the excuses government always use. But why is it that our other brothers, they are being paid?
I find it interesting that you say the teachers are being paid, because we get messages from them all the time about they being owed, teacher trainee allowances. So is it the case that government doesn't owe them as much in terms of the months? Yours is 14 months, but government may be owing them maybe lesser than that? Because what I know is that many of them are also not being paid.
As we are talking now, I think for the teacher trainees, those that completed recently, they've all been paid. But when you take the trainee nurses, when you take 2020, those who completed in the year 2020, government, they have an arrears of 1 month. Those who completed in 2021, they also have an arrears of 3 months. Those who just completed in 2022, that's the nursing trainees, 12 months. Whilst the teacher trainees, all their monies have been paid. So this is our worry, that what is happening? What is the government doing as of now? In fact, we are suffering, coupled with the fees that we have been paying each semester, not less than 3,000 Ghana cedis every semester. And we can attest to the fact that during the last vacation, students spent only 1 week at the house and they went back to school, going to pay another 3,000, more than 3,000 Ghana cedis again. And we are not receiving any allowance as government promised. So this is the reason why now we can't just sit aloof again.
Okay, let me come to you, Isaac. And this is a big conversation. It sounds controversial, but there are those who think that, look, we shouldn't even be giving you allowances in the first place. You should be treated like any other tertiary institution. So people go to the universities, if they need money, they sign up for the loans. Why should we give nursing trainees or midwife trainees allowances? Why?
Thank you for the question. Send my greetings to our cherished viewers and listeners too. With nurses, I'd like to say per research, we provide about 40% of healthcare services when taking percentage. And we are essential workers, as you know. As students, we are being trained to become professional nurses. And the question you asked, why are we not being treated at tertiary? The government said, I will pay you allowances. And most people, when they are going, they fend for themselves. And so with these allowances or stipends, that's what we use to pay the fees. Sometimes if we go for clinicals, we don't have facilities around where we stay. So we have to move. These allowances are there to help to cushion us a bit, to help or support us in doing this. The government is a promise to us and it has to be fulfilled.
Okay, so I get the point of it being a promise and the fact that it must be fulfilled. But as you sit here, sitting and looking at me realistically, your colleagues in other institutions are receiving education for other things. Doctors are essential workers as well. In the medical school, they don't receive allowances. So, I mean, realistically, from where you sit, I understand that it was a promise that must be honored. But should this be something we should continue seeing that based on your response, there was some level of expectation.
Yes.
So if that expectation was not there, some of you would not make a commitment to even go to the nursing school. So because you knew that you'd be getting allowances, you checked your finances and your ability to pay and survive, and that's why you went to school. But clearly it's a problem. Clearly, right?
Yes.
It's a problem. Government is unable to pay. Should this be something we should be continuing?
Yes, I would say it's something that government needs to, because a research that we did, a lot of training nurses bought the idea that of the government prior to the 2016 elections.
But you're being disappointed, and that's what I'm saying, moving forward. If you didn't expect it, you wouldn't be disappointed. Yes. So should we just, like some argue, revert to what the NDC introduced and said, look, you're not going to pay teachers and nursing trainees, so that just like at the tertiary level, everybody knows that it's not something they should expect. So they go in knowing fully that their guardians or their supporters would have to fend for their time in school.
Okay. So with what you just said, those in the tertiary universities, tertiary institutions, that the universities and other public institutions, they are being offered student loans. Let me put it that way. But we are not qualified to have those loans. And these allowances are what help us to also support ourselves in school. So that's what I would like to say in regards to that.
Right. I am told that we've been joined by your president, Pascal Edum. Is he via Zoom? Hello, Pascal. How are you? Great to have you here also to talk about your arrears. Clearly, government is unable to pay. I just want to know from you, have you tried to interact with the sector minister or, appeal to the finance minister? It's 14 months is a long time to have waited. What exactly has been happening throughout this period?
Thank you so much, madam. We've tried our best as national executives, and the patience of the trainees and midwives is something that should be appreciated. Because over a year now, we've not received the allowance, and as national executives, we kept out our best possible to engage our stakeholders and the relevant persons who are, as far as the allowance is concerned, should be contacted. And on all the engagements we've made, there have not been any positive feedback as to when the allowance will be paid.
Who exactly did you engage? Who exactly did you engage with?
We engaged the ministry. That's the Ministry of Health. That is the Department of the HR, the Health Training Institution unit as well. We've engaged them on the issue of the allowance.
Pascal, I mean, not to sound insensitive, but clearly, with the times that we are in and with all the effort you've put in and see no results, I mean, I understand that this was a campaign promise that had to be honored or has to be honored, but what are your members doing about this? I mean, I feel that by now you should be looking for alternatives to support yourself. Shouldn't that be the case?
Thank you so much, madam. When you look at this particular issue, when you look at trainees and midwives, these people we are talking about, they are essential people when it comes to the health delivery. When the health sector, the backbone of this particular health sector of the country depends solely on these people. And if we are saying that at high times like this, we should place less priority on people who contribute much to the health delivery of this country, then it means that the future of this country should be shaken, because these are people that risk their own lives, their families and other persons to support this country. And the Aswas administration, when they came, there was something we call the clinical token. And this clinical token was established after the research that was made by our mother union. And they said they're going to give them a tabletop token of 150 Ghana cedis. But training nurse and midwives, together with our mother union, saw to it that that was nothing worth the work that was done by training nurse and midwives. Because unlike other professions, where they have to go to maybe on vacations, they'll have to fend for themselves, where they are entitled to student loans. Training nurse and midwives are not entitled to student loans. And even during vacations, they have to go to the various health facilities. And depending on how far your facility is to your house, you have to go and rent an apartment. You have to feed yourself. You have to run night shifts. Even in the pandemic, where people were being asked to stay at home, training nurses and midwives were still at the various hospitals. They are prone to a lot of infections. Their families are exposed. And these are people we should place much priority upon. And it is high time that I see that, you see, a country that, I keep on saying that a country that is not worth honoring their heroes is not worth dying for. Because when you look at the sector at which people like this are putting up their best, their commitment and their expertise to ensure that these people of this country, their health delivery is supported, and we are placing less priority on them based on the campaign promises. It's not just a campaign promise that was made, but I'm seeing that the people reason with them because they show to it that the essence of the trainees and midwife to the country should not be placed less priority upon.
And doesn't this signal to you that probably it's time for us to relook at this whole concept of allowances? The Mahama administration scrapped the nurse and trainee and teacher trainee allowances and offered student loans to you, just like it happens for other people in other institutions. Doesn't this suggest to you that it's time to, take a second look at the concept of allowances?
Thank you so much. That's why I earlier on stated that when you look at the allowance, it's not just anything that maybe you feel like giving it to them because they're not worth it. But when you look at the importance of the allowance to trainees and midwife, I think that no Ghanaian would ever protest that trainees and midwife don't deserve allowances. Because somebody that during his tenure of education, while the person is even still a student, would have to be rendering service about 40%. That's a significant percentage that should be looked at. Because when somebody is rendering about 40% of health delivery to this particular country, the person don't deserve to be paid.
So you're saying that the allowance is justified because while you're receiving training in school, you are offering your services as well.
Yes, because when you look at the importance of it, that's what I'm saying, that the importance of the allowances, these people that I'm talking of, they render service, and about 40%, that was conducted by our Mother Association, 2015. When you look at it, 40% of health delivery is a significant figure. And when you look at it, you don't expect that this person who have to go and even rent an apartment, the person have to feed himself, he has to transport himself all days long, coupled with the fees they are paying. This is just something, even looking at the amount that are being given, could not meet this, but it's a form of appreciation that should be looked upon, and should place the priority on them as they help in the delivery of the health system.
How many of trainee nurses work within the sector? How many of them are working? Can you hazard a guess?
The training nurses and midwives like this, we have something we call the internal clinicals and the external. Mm-hmm. The internal is when they are on campus. When they are on campus, there's a period of weeks that are allocated that they have to go to the various facilities. So this is scheduled when they come back to the resume school.
So this is almost like an internship.
Yes. So when they are on campus, they go to the various facilities for some weeks to work. When they vacate again, they'll have to still go during their vacation period, depending on when they are vacated and the time.
But I'm sorry, Pascal. I mean, I'm just trying to understand. So, is this not a part of your course requirement? So, for example, I went to the Ghana Institute of Journalism, and as part of my 4-year training, I was expected to have at least some internship during the summer break in my 3rd year. It was mandatory. It was part of my course requirement. These clinicals that you're talking about, are they not part of your course requirements?
Yes, sharing not from the fact that they are part of our course requirement, but I'm just saying that the fact that it's part of our course requirement does not also differ from the fact that the contribution we are making to the country should not be looked upon. That's what I'm saying, that these are persons we should be looking up to. They form the backbone of this particular health sector. And training nurses and midwives who form the backbone of this particular sector, whatever treatment we are giving to them, depicts what the future of the health sector would be, since they are the backbone of this particular health sector.
Interesting. Let me come back into the studio. So, Lenov, everything points to the fact that it may take a while before you get your monies, right? How have you been surviving then? Because the picture I'm getting from all your responses suggests to me that you are almost helpless without the trainee allowances. I mean, I know some people may find it difficult to believe, but how are you surviving?
It's not easy for us at all. Though as a national executive, we have been encouraging our members to engage in entrepreneurship and other programs, but that alone is not solving the problem. The issue is that we expect government to fulfill the promises that he gave to us. In fact, as of now, even when you are in the house as a trainee nurse, parents have the view that you are receiving some amount of money. Either you are lying to them that government is not paying, because you might have a brother who is also in a teacher trainees, and they will always be receiving their money. Then the nursing trainees are not receiving. This is our issue. We are suffering. We don't know even how some of our members are even coping. Though we engage them that they should engage in entrepreneurship and other things, but it's not easy.
Isaac, what would you have done as an association if you were still in the times when there were no allowances? It's almost as if without the allowances you can't survive. What would you have done if, well, this government decided not to reintroduce the allowances? Do I get the impression that most of you wouldn't have gone to school at all? Is that the case?
That's not the case. With this issue, if it was cancelled, we all know, we have the assurance that it's cancelled, and to that, there's maybe an alternative that will be posted, because even once we are done with school, we are not posted. So if we be posted, or they are using that money, channeling it into developing different facilities or health facilities, or developing or providing logistics, we are cool with it. But they came in to say we are going to provide, hence we have to provide it. That's what I have to say with regard to that.
Right. Well, you're hoping that through this medium or channel, your concerns will be addressed. You say that you have tried to reach out to your HR departments at the Ministry of Health, but you've had no successes. I mean, you can only be hopeful at this point, right?
Exactly.
You're just hanging on to hope, isn't it?
Yes, that is it. But if of all our engagement and we still see this government is not paying heed to us, I think we'll find out how we.
And when the other way is what?
Definitely, we might speak the language that government understands.
Which is?
As we all know, we might go on demonstration, possibly, because we are suffering. As of now, we are suffering. We don't know what to do. So if government is not going to listen to us, because prior to the 2016 election, a lot of us bought that idea, and in fact, we campaigned well for this government, all with the hope that yes, one administration cancelled the allowance, one came to is coming to restore. So
there's a clear case of disappointment.
Yes. Totally. This government has indeed disappointed us. We don't want to miss ways.
How much are you paid every month?
Every month we are paid 399 Ghana cedis. 399, and just look at 399 Ghana cedis. It can't do anything. But at least when it comes, it will cushion us a bit. 399. Compare that to the fees that we have been paying a semester. The training nurse pays not less than 3,500 cedis per semester. And in a year, we have 2 semesters. So just compare, even our brothers in the universities, they don't even pay that fees. They pay fees in a year, but we pay in semesters. 3,500. Our handouts are out.
No, well, some universities pay in semesters that I know.
That is what I'm saying for degree nurses. Okay. Yes, for degree nurses, those in the public institutions, they pay in a year. But when we come to the diploma, that is the training nurses, we pay per semesters, and not less than 3,500 Ghana cedis. With this, our handouts is not part. Our hostels, facilities, they are all out. So just imagine how our parents are even suffering.
And to add to that, most of the training institutions are vacating. And you know, the academic calendar has been changed. They'll be returning to school in no time. So it's also another burden to them. So
yeah, for last semester, for example, students spent only 1 week at home. Then they resumed the following, and they were expected to pay 3,500 Ghana cedis within that short time. We asked ourselves, where?
But that has not been the case always. So
no.
there's something happening to the system and the curriculum
exactly.
that's making it so.
Exactly. That is the reason why at this time we are calling on government that at least the 1 week, we spent only 1 week at home. So at least government should come to our aid and support us with this allowance.
Okay. I know that there may be a lot of questions on the minds of people watching us, but let me just come to you, Pascal, as we wrap up the conversation. Your colleagues in the studio have told me about what the likely response will be if government does not heed your call to pay your 14-month allowance arrears. But as president of the group, I can imagine that you have a lot to shoulder as well. But I mean, honestly, for you, what genuinely should be the way forward in terms of addressing your concerns, but also finding a long-lasting solution or a long-lasting intervention to this issue of allowances and non-payment and cancellations and reintroductions? Briefly.
Thank you so much, Madam. That's what I'm saying, that when you look at the current issue, the issue of allowance, I don't want it to be like it's a political issue that people should be looking at.
Oh, no, but it is a political issue, Pascal. I mean, whether you like it or not, it is a political issue. I'm sorry, but that's the dimension it's taking now, because one government comes in to cancel, another reintroduces. So there's a political dimension and twist to it. So, I mean, it is what it is.
So that's what I'm saying, that when we look at it, that's what I'm saying, earlier on stated that cleanliness and midwife, they form the backbone of this particular health sector. And what I want is, if you want things to go on well, when you look at the various stakeholders, nobody will understand the reason why a student should not be able to pay school fees and then should continue to fend. But they will want to understand why maybe students should be able to understand government, because if government is not able to pay our allowances, we should cope with government because we are in hard times. But how many principals in this country are ready to listen to students when they are not able to fend for their fees because of their hard times? So what I wanted us to consider is making the trainees and midwife allowance a government policy instead of a political on political grounds as a political campaign of a promise.
All right.
Making it a government policy would go a long way to help. It should come to standstill, where any government that comes would have to do it, because considering the explanations we all have stipulated before, the media and then the entire Ghanaians, I think that they should look at it and value it as and place much priority on it.
Pascal, how many nursing and midwife trainees belong to your association?
We are over 100,000 members.
You are over 100,000. Okay, so per my calculation of 399 times 14, that's each of you receiving 5,586 Ghana cedis, right? Times 100,000. That will be, wow, that's a lot. That's about 558 million, right? 558 million. Well, we hope to get a response from the Health Ministry on this, and I wish you all the best in your endeavors. But I know many others would also be thinking, if you can afford over 3,000 cedis a semester to pay your fees, why should 300 cedis be such a bother? But I see why you are here, because cumulatively that can pay another semester's fees, right? Mm-hmm. Well, thank you so much, gentlemen. Pascal Adumbisa is president of the Ghana Nursing Midwives Trainee Association, and in the studio I had to my immediate left Leonard Amponsa, who is the National Secretary for International Relation Affairs, and Isaac Danakofi Arthur, who's the National Coordinating Secretary. Well, that will be it for our conversation on the nursing trainees who are not receiving their allowances. Their demand to government is that, just like the teacher trainees, they must receive what is due them. So we've got a couple of conversations to have here as well on the AM show. Do stay with us. We'll be right back with more.